Howdy friends, your city manager Seth Sumner here with your daily COVID-19 update. It is Monday, May 11th, 2020, and this marks the 57th video where we have shared the Tennessee Department of Health data with our citizens, as well as a lot of good information about the local approach, friends and neighbors that are in need, how can we help. A lot of folks have come on the daily update to share perspective from various areas throughout our community. And we want to continue to be that asset for you, our citizens, Athenians, because you care so much about our friends and our neighbors. We love each other, and we're going to take care of each other and do what's best. We're going to be responsible. And so let's start with today's Department of Health data. And of course, we took off yesterday to spend time with our mothers, our mother figures, letting those people know how much they mean to us. And so I appreciate all that our mother figures and moms and grandmothers and aunts, all of those important women in our life, what they do and the difference that they mean in our own lives. Thank you, moms. So our Tennessee Department of Health is now showing 15,544 COVID-19 positive cases from the onset of this pandemic going back to early March. That is a change, an increase of 559 since yesterday. We have seen, thankfully, over 8,000 recovered. That is 510 Tennesseans now joined that group of recovered Tennesseans since yesterday. And so this is now trending upwards again, getting back into an over 50% range. Actually, this will show you on the next slide, we'll look at 52% of people who have been diagnosed as COVID-19 positive, now fully recovered. We want to see that continue to grow. We have 273,277 total tests now that have been conducted across the state of Tennessee, and that is an increase of 11,408 since yesterday. So a couple numbers that we do want to pay very close attention to and we want to be respectful of are, of course, the 1,344 Tennesseans who have needed acute care for their symptoms from COVID-19. And that is an increase of, thankfully, only 19 since yesterday. And now our hearts, our prayers, our thoughts, our concerns are certainly remaining with those who have lost their lives now to COVID-19. And that is a number of Tennesseans, 251 to be exact. That is an increase of 8 since yesterday. We don't want to see anyone else lose their life to this pandemic, to this virus that has caused so much destruction, so much anxiety, so much heartache among our people. We want to be mindful of the people who have been so adversely affected during this pandemic. And we want to do our part by continuing to stay apart. By using good hygiene, we talked about washing your hands with warm water and soap for 20 seconds, making sure that you wear your face mask. Right now, I didn't necessarily intend to say it, but I may have coined a new phrase. Right now, love is a face mask. Love is covering your mouth and nose and making sure that when you're out in public, you're out at the grocery store, out at a general merchandise store, out making those runs that you need to make to keep your household going or to protect your livelihood, that you cover up. And that's a choice that only you can make. That is up to you to discern and to show other people that you love them by protecting them from COVID-19. Whether we have it or we don't, most of us don't know. We don't know whether we have it because most of us have not been tested. So if you are interested, If you want to get tested, those tests are available to you at the health department. Monday through Friday, 9 a.m. to noon. It's a drive-up test and it's free. There's no charge whatsoever. I would encourage you, if that's your wish, please go take advantage of that testing so you can have peace of mind whether you have COVID-19 or not. And that's more important now because what we're understanding from a large percentage of our population that have tested positive is that they're asymptomatic. They're not showing any symptoms for COVID-19. They don't have that cough, that scratchy throat, shortness of breath, fever, the things that we saw listed for the last couple months now as those symptoms. They're not experiencing them, but they have the virus. There's some hope in that, but we have to know whether you have it or not. And so for your own peace of mind, those tests are available to you if you wish to know. Let's tune over and look at our next data dashboard. We see across the state, not much has changed as far as the heavier hit populations. Shelby County, Davidson County leading the number of positive cases, and certainly the entire metro area has been very heavily affected. In our neck of the woods, we've got, of course, 240 positive cases down in Hamilton County, and 22 in Meigs, 6 now in Ray County, 604 in Bledsoe, and that is because of the prison population there. Largely asymptomatic, but a lot of positive tests in the prison system. We've got, of course, McMinn County right here at 122 COVID positive persons today. Let's scroll down and look at this data a little closer. Here is that recovered number I was talking about a minute ago. 8,038 Tennesseans now designated as fully recovered, and that is an increase. Last week we talked about this number. It was 48%. Now we're at 52. That's trending upward. We want to see that continue to rise and eventually be as close to 100% as possible. We are still seeing a 2% mortality rate with this virus. So 98% are able to either recover on their own in quarantine at home, or a few are needing acute care with hospital, ICUs, or ventilators. But 2% is the mortality rate right now, and that's held true pretty much the last several weeks. And what we continue to see right here are our age groups of who is affected the most. Still, but just barely, still 21 to 30-year-olds make up 19% of cases. Only one death in that case or in that age range. Just shy of that is my own age range, 31 to 40. We're catching up with the 21 to 30-year-olds. 31 to 40, again, 19%, but 3 deaths. That's a 1% rate. 41 to 50, 51 to 60, you can see the trend here. They are fewer numbers, fewer percentage of the population, but when you look over here at deaths, and these are not the titles here for these numbers, of course, the percentage that are affected by mortality, the higher you get in age, the higher the percentage are adversely affected by mortality. And that's why this entire time, and still moving forward from this point for as long as we can see, it is going to be important that we continue to wear our face masks in public, that we continue to use good and proper hygiene, that we still continue to socially distance ourselves. And we've been out checking the stores, making sure our business owners, our local businesses are doing what's in their own best interest by protecting your health. There are lines, there's boxes, there's posters, there's information so that you know what's expected of you when you're shopping and when you're out there. Where to stand while you're waiting for the cashier. You've noticed that there are splash guards put up around cashier stations now to help protect everybody there. And so we want to be mindful, we want to be respectful, and most of all, we want to be responsible because we love each other and we want to take care of each other. We care for our own health. We care for each other's health. And that's important here in the Friendly City because we have that personal connection with all Athenians. We share that together. We also have a lot of guests that come in from outside of the city of Athens that like to do their business here. They like to do their shopping with us, and we love having our guests here. But we want our guests to be respectful of each other and to the Athenians, to our folks here, by being responsible and making sure that you're being safe, that you're practicing good health and good hygiene while you're out among us. And so we appreciate everything that you're doing, Athenians and McMinn Countyans. Keep up the great work because we can show outside of our cluster that we've done a great job, better than just about anywhere else in the state of Tennessee as far as getting tested and knowing whether we have COVID-19 or not. At protecting your health, at socially distancing, you've largely been the most responsible group of people across the state of Tennessee. That is incredible, and that's all on you. Great work, folks. We're going to keep that up because I know you don't, and I don't want to be the reason that somebody else gets this virus, that somebody else dies from this virus. We're not going to be the cause of that. We're going to protect each other because we love each other. All right? So let's look down a little bit further, and we see McMinn County. And some of y'all were asking about this continually. I think we've addressed this a number of times on the daily update. And I'll remind you, in case you haven't been following along for the 57 videos that have been published now, is that this is the Tennessee Department of Health's numbers. It's their data. They collect it. Everything that happens at a primary care physician, at any of those facilities, at a hospital, anywhere in the state of Tennessee, in prisons, in long-term care facilities, nursing homes, anything that happens has to be reported to the health department. This is a reportable virus right now. As many other viruses, diseases, things of that nature are all the time. This is a new one. It is a reportable. So they have their own mechanism for collecting those reports and then inputting that information so we can all see it. And you have every bit of the same access to this information as I do. I'm not telling you anything that you can't find out on your own. So, and I do go out there, go on Tennessee Department of Health website and look at more data than I'm showing you here, just so you can get the full scope. You're absolutely welcome to do that. But we just cite the numbers so that we know that they are absolutely true. We don't want to misreport anything to you. And so we wait and rely on the Department of Health numbers to be updated before we share that with you. And so nothing is hearsay, nothing speculative, nothing is going to change down the road. It is, and it may not be the absolute latest, greatest information, but it is accurate. And accuracy to us is what's most important. And so right now, because you were asking about it, McMinn County, it was reported accurately in the media, and now the Tennessee Department of Health data has been updated with, unfortunately, 8 McMinn Countyans who have lost their life to COVID-19. Those are elderly people right here in our own community. These are friends. These are loved ones. These are grandparents, aunts, uncles. This is family. This is our family being adversely affected by this coronavirus and passing away prematurely because of it. That's why it's so important for all of us to do our part by being responsible. Wear your face mask, wash your hands, Keep a distance from other people. Use your hand sanitizers after you touch things that other people may come in contact with. Do your part to protect your own health, because if you do that, we can help prevent more of these deaths from happening. And that's our goal. So, unfortunately, 8 McMinn Countyans have now lost their life to COVID-19. We'll look at our other data sets. Something we're very thankful of is 32 now. This is a great increase in this number. 32 fully recovered McMinn Countyans out of a total of 122 who've been diagnosed COVID-19 positive since the beginning of this pandemic. And now we're edging on 2,000 tests here locally. I know we'll hit that tomorrow. 1,977 McMinn Countyans have chosen to not have a doubt in their mind and to get that free test to know whether they have this virus or not, so that they can protect your health. They can protect their own health and the health of others by being sure. This is 1,977 negative McMinn Countyans, and we love to see that. We love to know that we do not have it, because we understand we may be asymptomatic. We may not show any symptoms, but we have but we're still carrying that virus, and if we're carrying that virus, then we can easily transfer that to some other person. And it's important for us just to be very considerate of this, because these are historical measures. You go back to yellow fever. Please read and understand yellow fever and its effect, and how people acted, reacted, what was required of them. It's largely the same. And you know what? There are other diseases, there are other issues out there. You think about AIDS. There's still no vaccine. We cannot put all of our hope into a vaccine that's going to come about in months or years. It may not happen. And I don't mean that to be negative or talk down, but we have to be realistic about our expectations and the effect of this virus. It is being studied right now because it's absolutely new. It is a novel coronavirus. It is new. It's never been seen before in the world. And so our scientists are studying it, trying to understand it. We're learning new things about it and how people react to this virus differently every day. And so we're really, more than anybody really can appreciate, we're in this together. And we rely on each other to protect each other's health so that we can live and enjoy the freedoms that have been bestowed upon us in this great nation, in our republic. This is us working together. That's what the republic is built on. It's built on trust. It's built on trust, and it's built on believing and loving each other. Read it. It's all there. It's all something that we've studied at some point in our life, and maybe you need that refresher. But go back and look also at yellow fever. Read about how Philadelphia, especially, how George Washington was affected. How did that great patriot respond? Look into it. You'll probably see a lot of likenesses with today, because they didn't know what it was. There was a lot of questioning whether it was even real. We're seeing some of that same mentality exhibited in people right now today, when we have proof, because we have loved ones that are dead because of this. So let's be very thoughtful about how we're responding now, because we have technology, we have data, we have information that has never been available publicly and to you throughout the history of mankind in this earth. But we can still act the way that responsible citizens act, and have acted historically, is by just being cautious. Because we love each other, we're going to protect each other. And we're going to see tomorrow, and tomorrow is going to be better than today. That's hope. And that's where we stand here in this great community, as very hopeful. So I've got a few other announcements, and then I'll tune out for today. Be a nice long meeting this afternoon with the City Council. The First Lady of Tennessee has announced this Saturday, May 16th, as a day of service. And so that has been announced on social media. I know you love to give back. You love to give, Athens. And so if you're interested in seeing more about what this day of service is, log on to social media and look up Day of Service, May 16th. And that is from First Lady Maria Lee. Coming out, I know it was on her Twitter earlier. There's also, I'll share this with you because we have talked so much about the hurt that exists in our community, the anxiety, more than financial, more than physical, that there's actual emotional problems, emotional issues that we are each facing. And if you find yourself overwhelmed at any point, if you need help, there's a good way for you to get that. This is our Tennessee statewide crisis hotline, and I won't stand in front of it so you can see it as well. But if you have yourself or any loved one that you know of is having any kind of anxiety or issues or feels overburdened psychologically, emotionally right now, then please use this number. Use this resource to help that person. This is the crisis hotline. There's absolutely no charge. It's free. There are counselors, licensed counselors on the other end of the line that can help you, that can have that conversation with you or that loved one. 855-CRISIS-1 or 855-274-7471. Use this resource if you are in need. The Athens recovery team, we had two members, Jordan Curtis and Whitney Kimball Coe, on this past week, Thursday and Friday, to talk about that Athens recovery team. You have seen the flyers that we've put out. Just good guidelines and reminders, things to be very considerate of as we're all looking forward to businesses reopening, to us as consumers being back out into businesses that we may not have been able to visit in the last couple months. So as we're doing all this reopening, rebooting the economy, trying to get folks back to work safely, cautiously, as we're doing all that, we want to have a friendly city approach to that. And that means this team that was built out of the Council Advisory Committee right here within the city of Athens is building a one-stop shop for all of our folks. It's going to be a website that we'll be rolling out very soon that will be a one-stop shop with those good reminders, best practices, links to other information and data, and it'll be a really nice page that you can go to as a business owner, as a citizen, as a person in this community that cares about people, that cares about our own lives. It'll be a good resource for you. Everybody is free to use this, and it'll be a web page that'll be accessible to all people. And so we'll have that resource. We'll be rolling that out very soon. And as we roll that resource out, and hopefully these trends continue over the next couple of days, we want to be moving away from these daily updates. If we get to a safe, comfortable place, then we'll be pulling these updates back from being daily to maybe once a week. We're going to use that website when we announce it as the main resource for the community to get all the information that I've been sharing with you for these 57 days. You can go there and get that information. But more than that, we do find the value, and we've heard from you folks. We've heard from Athenians at how valuable this information has been during this pandemic, and we want to continue to bring that live feed to you. And so you've seen me out in parks and resources that citizens sometimes forget that we have, or maybe you haven't heard of this resource before. Eco Park, Heritage Park. I want to get out into the community, into the city, get out in the city to show you what those resources are, what's going on in our community, how is your city doing the work that you asked us to do, what are we doing to improve your life. I want to show that to you, and there's no better way. I'm a visual learner like a lot of you are. There's no better way than to do it on a video. And so I'll be getting out into the city, hopefully maybe about once a week, and making that a regular scheduled thing to share the great story of public service, to share the great story of what Team Athens is doing to improve your life. And so we'll be changing this daily update into a weekly thing that'll talk more about what's happening right here in the friendly city than focusing on this pandemic. But we want to make sure we're in a good, safe place to do that, and offer you another resource to have that local information, that local update, without having to do a daily video. Because it does take staff time. James, the assistant to the city manager, has been a wonderful, wonderful treasure during all of this, 57 days worth. He's done a tremendous job at putting these things together, handling the camera, being behind the scenes. And so I really have to say a big Friendly City thank you to James for his work. He's taken time away from his family, as I've taken time away from mine, to be with you and to be able to update you every day, except for I think there were 3 days that we did not come on, and the holidays, Mother's Day, those things. But we've been with you this whole time, as we said we would. As we promised you, we're going to update you daily about this community, about this virus, so you have the best information, accurate information that you can take to the bank, that you can believe, that you can use to make sure that you're making good decisions for you and your family. And that's service, because that's what we pride ourselves on here in the Friendly City, is making sure that we can get to our citizens what our citizens need and want. And so, thank you, James. Thank you to all of the folks that have been watching every day. Please keep watching. We'll have, as we transition into something else, we'll have more and more great stories to share, and perhaps more interviews with people who are making a difference right here in the Friendly City. And so for all you Athenians out there, may God bless you, and may God bless Athens.